National Institute for Communicable Diseases has been hosting workshops in preparation for a possible Ebola outbreak. This is part of South Africa's preparation for the deadly virus. World Health Organization has warned that Ebola has been spreading at a rate faster in the DRC. Joining us now is Prof. Tulio de Oliveira, Director of the Center for Epidemic Response and Innovation. Prof, a very good morning to you, and thank you so much for joining us. Prof, how susceptible is South Africa to an Ebola outbreak?
Okay, thank you, and good morning to all your viewers. Yeah, so it is very unlikely, extremely unlikely, that we're gonna have an outbreak of Ebola virus in South Africa. So, and the reason for that is because the virus do not circulate here and do not emerge here. It tends to emerge in West and Central Africa. Yeah. However, what may happen, it is that we receive like someone that have been exposed to the virus, and that's a very distinct thing. Yeah. So, for example, as we speak now, most of people that are diagnosed or suspected with Ebola virus in the Democratic Republic of Congo, it is all treated, both in the DRC. The Doctor Without Borders have set up 15 isolations and 7 training treatment centers, or in Uganda. Uganda is also very advanced on management of Ebola. Yeah, and what we had a few individuals, that were in the region, that were suspected and then went to different countries. So, for example, we had a whole family that went to Germany, that were treated at the Charité that's in Berlin, and none of them developed disease. We have an individual that went to France that was also treated and developed disease. And at the moment, we have 7 medical personnel from a United States NGO that are just in quarantine in Kenya with not sign of infection. So it is very unlikely that we're going to have many introductions. What may happen is that 1 or 2 individuals that may have been exposed travel through South Africa.
So with that kind of exposure, Prof, I mean, this particular outbreak in the DRC is the Bundibugyo strain and not the more familiar Zaire strain that has had vaccine approved. How does the absence of a vaccine for this particular strain possibly then change South Africa's containment strategy if a case does arrive? Okay.
So first and foremost, South Africa has a really advanced virology experts, some of the top in the world, and I think that people noticed that during the pandemic. The NICD is extremely well-performing organization, and we have dozens of what you call BIOS levels, security 3 labs. We have some of the highest ones. So we are very well prepared to both diagnose Ebola, and we have widespread diagnostic kits. So, for example, my institute, the Center for Epidemic Response and Innovation, is just sending thousands of qPCR, that's the diagnosis, to support the Uganda response. So we do have a lot of the expertise, both in virology, and the NICD is very well trained. And we also have the facilities to isolated patients. In relationship to this new strain, there is good things about that. It's a much less aggressive strain than the Zaire and the Sudan strain of Ebola virus. But then what is in the moment, people will develop disease much slower and a lower case fatality rate. However, there is no vaccine or treatment, which is being worked now. What we know is that if people present early through diagnosis, normally they can be treated, just maintain on basic treatment, and they will survive. and that at the moment it is what the Doctor Without Borders and other organizations are supporting in the Democratic Republic of Congo.
Prof, so our country, South Africa, has only one of 2 biosafety level 4 labs on the continent. What does that actually let us do that most other countries can't?
Okay, thank you. So there is clear guidelines on how to handle hemorrhagic fever virus samples, with Ebola is one of them. So for most, what it's the World Health Organization guidelines is that diagnosis can be done in a BSL-3, biosafety level 3 laboratories, which South Africa potentially has the highest number in the world. So, for example, in our building where the CERI is based at Stellenbosch University, we have 26 BSL-3 levels that could be used for a diagnostic. A BSL-4 lab, it can be used for development of diagnostic or for propagation of the virus. In Africa, we have 2 of those, and one is the NICD. And what I understand is that the NICD, but also other biosafety level 3 labs, in South Africa, are fully prepared to deal with any kind of diagnosis of Ebola virus. So, and that is quite important, this preparation. But again, we have no reason to expect many cases or outbreak in South Africa. And if someone appear here with Ebola, we have more than enough expertise to manage both the disease and the diagnosis.
So, Prof, I mean, we've lived through COVID, through Mpox, through other Ebola virus outbreaks. What would you say is the single biggest operational lesson from these outbreaks that now get baked into the Ebola readiness plan, not just in South Africa, but in some of the countries that we are seeing on the continent that certainly do need these?
Okay, so thank you, and you highlight. So we had COVID, was a very big pandemic. We also had other very large outbreaks in South Africa of HIV and TB, which is decreasing, just showing how well the country can manage. And even Mpox, we end up not having many cases in South Africa, and the diagnosis was rapid and isolated and without outbreak. So South Africa is very well prepared for dealing with virus outbreaks. Unfortunately, this outbreak of Ebola virus, it is happening in the most, one of the most poor and with least healthcare system areas in Africa, that's northeast of the Democratic Republic of Congo. So that's an area that is under conflict, armed conflict, that there is a lot of illegal mining, and that the health system is really, really deprived. And the main lessons that we have from dealing with outbreaks is that the most important would be to support this area, to control rapid. For example, that's what our own group is doing with support Uganda and the DRC and also the NICD, and even our president, they send support to do that. What we know from outbreaks is better to control where it is started than to deal that later.
All right, Prof, thank you so much for laying the fears of South Africans aside, especially to the non-possibilities of an Ebola outbreak in South Africa. Thank you for your insights.